Hello, I'm Jay Cox, President and Chief Executive Officer of Tuomey Healthcare System, and I want to welcome you to the first edition of Tuomey TV. You'll see us here on cable each month, bringing you a behind-the-scenes look at Tuomey. Now, please join us for our first segment featuring Tuomey's Rehab and Sports Medicine Department.
Thank you, Jay. We're very excited to be here. I'm Brenda Chase, Director of Public Relations and Marketing for Tuomey, and today I have with me Jerry Shadbolt, who is our Director of Rehab Services. Welcome to the show.
Well, thanks for having me.
Thank you. Jerry, can you just first of all start talking a little bit about what Rehab Services does here at Tuomey?
Sure. We're an outpatient facility, and we offer physical therapy, occupational therapy, and sports medicine services, as well as cardiac rehabilitation.
Wonderful. Let's talk about physical therapy for a little while. What are the different elements that you offer here?
Sure. We offer orthopedics, anyone that has a shoulder, knee, ankle, hip, spine-related injury or illness. We rehabilitate those people and get them back in action as quick as we can. We also have a pediatric division, anything from developmental delay, any type of pediatric illness and or diagnosis we see as well.
Right.
As well as a sports medicine component. We have athletic trainers that go out to high schools that cover football games. We have an injury clinic here on Saturday mornings, and again, we take care of some of the local high schools.
Wonderful. Tell us a little bit more about that high school program. That's interesting.
Sure. We contract out with some of the high schools, primarily Thomas Sumter and Wilson Hall, and we provide athletic training services. We go to their football games, take care of their athletic injuries, as well as their injuries throughout the week. Included in that, we have, again, the Saturday morning injury clinic where the athletic trainers are present, an orthopedic surgeon is present, and a rad tech to do the x-rays for the kids.
Wonderful. Now get back into the building a little bit. You have cardiac programs that also go on here?
We do. We have a phase 2 and a phase 3. A phase 2 is when a patient comes straight from surgery or a procedure. They're monitored with telemetry, and the cardiac nurses monitor them and get them on an individualized exercise program. Phase 3 is a maintenance program. Once they've graduated, if you will, from phase 2, they'll start with phase 3. And again, it's a monitored individual program.
Wonderful. And I understand you work a lot with the orthopedic surgeons at Sumter Orthopedic Associates?
Correct. They cover our injury clinic, and they help us cover our high schools.
Wonderful.
As well as we have a great line of communication with them, and we see a lot of their patients for them.
And you have a beautiful, beautiful facility here.
Well, thank you.
Jerry, tell me a little bit more about your staff here at Rehab.
Sure, I'm glad you asked. I like to brag about them the most. We actually, when we hire people, we hire based on their person that they are versus their credential. So it's really important that we hire good people, because we want to make our patients come in here usually have difficult situations, so we want to make a difficult situation fun. Our therapists are very caring, they're very concerned about good outcomes, and they like to have fun with rehab, and that's really important, and that's what makes our patients happy. We have a 19,000 square foot facility. Housed in that are our physical therapists. We have 6 PTs. We have 3 physical therapy assistants. We have 3 occupational therapists. We have rehab techs. We have cardiac nurses, athletic trainers, as well as a great office staff. And all of our therapists are credentialed. They're either licensed or certified to perform their jobs.
Wonderful. And it's a great atmosphere. It seems like y'all spend a lot of time on customer service.
We do. In particular, along with our peds, we have occupational therapy. We mentioned that. Our OTs work on fine motor skills, work on patients that have had strokes, any type of hand or wrist injuries or elbow injuries, as well as they work a lot with the autistic kids, which we're seeing a large amount of autistic kids in the area now.
Right. Wonderful. Well, I appreciate all this information. This has been a great visit out to your rehab department. Thank you.
You're welcome. Thanks for coming out.
Hi, I'm Brenda Chase. Thank you so much for joining us today for Tuomey TV on Sumter's Marketplace. We look forward to seeing you next month as we visit the Core Institute.